Hello friends, welcome to Local Mart Doctors. Or friends, today we came to Safdarjung Enclave, and here is one clinic available of physiotherapy. Dr. Raavi Asparagus Clinic, Center Clinic, and it is available in Safdarjung Enclave. And friends, Dr. Raavi is with us. She is like a physiotherapy plus she is orthopedic as well. And we are going to introduce you with Dr. Raavi. She is going to explain her services, therapies, what they are doing, what their team is doing here, and their timings, their clinic timings. They are 7 days open, 6 days open, and what is their specialty actually. So let's start with Dr. Raavi.
Hello everyone, myself Dr. Raavi. I am the owner at Asparagus Center for Advanced Physiotherapy, and we are here for now since 2015. We opened up our center and now we are here for quite some time. So we have been running our practice for quite long now in Safdarjung Enclave. We have a good client base over here, and we are seeing all variety of patients who have their ailments related to aches and pains. The clinic opens in the morning around 9, and the last entry of the patient which we take is around in the evening around 7. We are open from Monday to Saturday. Sundays is off because our therapists also need some kind of rest. Otherwise, we also deal in home therapies. So supposingly there's an emergency patient at night, at 12 or even at 1, we attend to that also. You have to just make sure that you dial the correct number and we'll be there to help you out even at your home. And in the clinic, again, we have all varieties of patient. We have wheelchair facility, lift facilities available over here. So that supposingly you drop in and you are having some trouble walking down the stairs because our clinic is in the basement. So we have all that facility available. Our staff is there to help you out, and we run our practice here to help you. So we are always here for our patients.
So ma'am, can you please let us know this branch is how much long actually, and plus you have other branches as well inside Delhi or outside Delhi?
The clinic we started in 2015, April 4, 2015. We had a center in block B5, 87, Safdarjung Enclave, and we were running up there, but it was not our own place. So then just before COVID, we moved here in B2. B2 96, that's our present address, and so the whole but the clientele remained the same because we are in Safdarjung Enclave. So it is somewhere around 7 years now that the clinic has been running, and we are in the 8th year. So up till now we are seeing all variety of cases here, and we don't have a lot of branches, but this is our main branch. But we have a full-fledged team of home physiotherapists. They cover the entire Delhi and also Delhi NCR. So supposingly somebody is sitting in Faridabad or in Ghaziabad or in Gurgaon, so it's not that they'll not get our services or the quality is going to degrade, because I keep a direct contact with all of my patients and my therapists. So we have a team of say 10 people who cover the entire Delhi, and whatever the case is, it first goes on to me. I am in direct conversation with the patient and the therapist over a telecommunication, and then I tell the therapist that this is the plan of action which we need to follow, and thankfully the team is so trustworthy that they follow whatever is advised to them, and we are maintaining a good clientele on that basis.
So ma'am, can you please let us know what kind of problems is very general in this clinic which you facing on day by day actually, and normally you have the expertise and you providing the services on that?
So see, usually the people who are here, they come for usual neck pains, back pains, and sometimes headaches, vertigo. Some also come for insomnia and generalized knee arthritis, swelling in the limb. But for the past 2 to 3 years, especially after COVID, I'm seeing a lot of clients who have a lot of breathing issues, a lot of reduced lung capacities. So we see a lot of clients who come over here with and they tell me that, ma'am, I'm having problem in breathing, I'm not able to breathe, although when you go through a X-ray scan of theirs, it is not that bad. So we devised a program. Recently we were in talks with a lot of therapists around that what to do. So we started with a protocol where we give them a lot of chest expansion exercise, a lot of breathing exercise, a lot of chest clearing. We have a few devices which help us in that. So the therapist follows a protocol where there is 40 to 50 exercises with proper positioning and a proper postural drainage of whatever secretions are inside the lungs and all that. So they really help the patient improvise their breathing. Along with that, we have also been seeing that, especially our geriatric patients, so patients who have been old and who were not able to handle COVID, but COVID happened. So they face a generalized body weakness, which is kind of, unbearable for them at times. They cannot do even their basic works. So for that, again, we have an entire head to toe full body program where we do a full body deconditioning. There we start with relaxation therapies along with some myofascial releases for the body, and our machines, they help us in increasing of blood flow. So now when we meet our patients, say after 2 months and 3 months, they are hale and hearty, they are going for their walks. So that is something which we have, improvised. Along with that, a lot of complaints which nowadays are coming is in children. They come with a lot of bone related discomforts and disorders. So some people are having flat foot, some people are having early backaches, early leg pains, and leg pains is something which happens with every child, but we are seeing some abnormalities like pain which is intolerable in children. So as I am MPT orthopedic, I'm masters in my field, we every time to time, every weekend now, depending on our cases, we devise some new programs for our people who are affected. So for our children, like we say, we started with a whirlpool therapy and with a lot of electrotherapy combined in that whirlpool therapy. And we could see that within no time, we saw a lot of recovery in their feet and in their day-to-day activities, and they could do that without pain. So that is what I'm seeing right now, but this changes, like the clientele changes. Like winters we were seeing different cases, now in summers I hope we see something different also. But we are here, our whole staff of physios who work day and night to at least give complete relief to our patients. So we are thankfully, by God's grace, are being able to do it.
So, ma'am, one very basic questions, like that we having lots of physiotherapy centers like in Delhi actually. So what's make you special, or what's like make you unique in terms of other normal physiotherapy clinics?
So see, this is a very, a question. I cannot basically praise my own self. So I won't say that, I'm the best. I think a lot of people who are working hard in the field are doing their best. But one thing which, a lot of patients of mine, they tell me over the years that, ma'am, whenever we go to a doctor and we want certain kind of therapy or certain kind of medicine or anything, the doctor never says that you can be completely fine. So is it against your field, or being a doctor, you can never make us 100% fine? So I would answer that question by saying that we maintain a very strict 100% success rate criteria. So whosoever walks in, it's not that we are gods, it's not that we have some spiritual power with us, but when somebody walks in with pain, and if that pain is related to physiotherapy, we really take it very seriously, personally, and we care about our patients. So we sit back. Each and every patient's case file is studied individually, and supposingly some patient has been suffering for 4 to 5 years, has gone to 10 physios and has not found relief. So we try our level best to find techniques. If whatever techniques the patient are being used on the patient did not help him or her, then we try to do something different from what was being done usually. So that has helped up till now. We maintain, when I say that I maintain a 100% success rate, it's not that I'm just talking. So if you go and you check my Google reviews, you check my website, you will come to know, and you see the videos of the patients there. So there are videos where we started with the therapy and what the patient looks like or is like after say 3 months or 2 months. And it comes out in a wonderful way. So I feel the only thing is sometimes when the doctor doesn't tell you that that you will be 100% better or something, because they don't talk to the patient too much, or sometimes they are so busy in their day to day routine that they don't have the time to communicate it to everybody. But we as physios, we are with the patient for quite an amount of time, say 1 hour of therapy. So my job is treating the patient as a physiotherapist, but along with that it's also counseling and in creating and increasing a positive environment around. So that really helps, and that ways thankfully we are able to treat all our patients completely.
So, ma'am, how do you treat your patients? Example, like in some conditions might be you required like manual therapies or manual way to do it, or in some conditions might be required some equipments as well. So, how you specify those conditions where you require the like manual or where you require the like machinery kind of therapies? So, please specify something about, and especially the differentiate the between manual and this equipment based therapies.
So, see, whenever a patient walks in the center, our policy is we start with the basic assessment. If a patient has not been assessed, we don't start with the therapy. So, supposingly, if somebody walks in and says that, ma'am, this is a doctor's prescription, and the doctor has said that you put IFT and ultrasound, I would say that, I won't put that until unless I assess you. So, assessment is must, diagnosis is must. Until unless I have diagnosed that what's wrong, because if somebody walks in here with a backache can be due to 100 reasons. So finding the reason is one of the most important things at the center. So we start first with the assessment and the diagnosis. Once the diagnosis has been done that this is the condition, whether the pain is coming due to a nerve impingement, or it's coming due to muscle weakness, or due to disc involvement, once we have assessed that, then we start with the therapy. The therapy again is not always manual. It's not always based on machine based therapy, which we called in as a broader term we name it as electrotherapy. So every time it's not electrotherapy or manual therapy, it just depends from case to case. So supposingly somebody comes in here who has a weak neck, and I assess and I examine and I see that the patient is also having vertigo, it's also having headaches and dizziness. So my first criteria would to take the pain away. That is something, because if you are having pain, no matter how much manual therapies I do, you'll not enjoy it. And my basic criteria of doing therapies here is it should be enjoyable also. It should not be a torture for you, that you come here and you just coming here to show another doctor, and again that 1 hour is just not passing. So we start with basic electrotherapy, which gives a lot of pain relief, because through our hands sometimes giving pain relief can increase a lot of soreness, and if the patient is having inflammation and swelling, that could result in increase of pain. So I really don't go and touch the patient immediately and start doing some manual tractions and all that. We start with some basic electrotherapy like ice therapy or heat therapy, and along with that we have IFT, we have ultrasound, we have TENS, we have wax therapies. We also have shortwave diathermy, that's magnetized heating. So once we have used those therapies and we have reduced the pain, then we start working on the flexibility and mobility of the patients. Then the manual therapy comes into place. There we stretch you up, we stretch your muscles. Again, if the neck is tight, we give some stretching exercises for the neck, some myofascial releases for the neck. And after that is third and one of the most important criteria for any case, that is strengthening. We don't consider the session complete without giving you a bit of strengthening, because at the end of the day, no matter how many machines we put on you, how much stretching we provide, if your muscle is not strong enough to hold your posture correctly, you will have that trouble again and again. So here there's one more unique thing at our center, that if somebody walks in here with one kind of ailment, that person, touch wood, would not come back again with the same ailment until unless he or she has done something out of place or some jerk or some accident. If the patient has taken their program here and they are continuing their exercises religiously at their place, they would never complain of the same pain again. They might have some other pain at some other body part, but not at the same joint or at the same place. So that is how we treat. Again, the therapies which were there 20 years back, there's a lot of advancement even in the machineries. So the TENS which earlier we used to have was just a 4-channel TENS with 4 pads. Now we have a 12-channel TENS with a lot of ways of covering a lot of parts in the body. So supposedly somebody comes here that I have neck pain and I have leg pain and I have hands paining, and I see and I assess the patient, and it might be that the patient is having some nerve issues. So we have specific nerve therapy programs also in our machineries. We use those nerve specific machineries for giving you complete relief. So that is how we treat.
So ma'am, we also want to know something about your packages, like what are your charges, etc. Plus main thing is that like through this channel we are of course trying to generate some awareness, so you can get some inquiries and users also get some awareness. They also came to know like in nearby areas doctors are available. But the main thing is that through this channel we also trying that to provide some kind of benefit to our users as well, who seeing us and they taking the courage to come to your clinics and take their services, whatever their problems actually. So they should also get some benefit in terms of discount. So can you please let us know what kind of discount we can expect from your side if any user coming from our side?
So when a patient comes to our center, the first and foremost thing which we do is we don't charge any consultation. That is one thing, like our consultation is free of cost. That is one thing which we do. And another thing is like packages, we have different packages available. So supposingly somebody comes here and takes a therapy of 1 hour or more than 1 hour, then we know that we have to give electrotherapy also, manual therapy also, have to start with weight training and some other massages and myofascial releases also. So we try to club up the cost. We don't charge very exorbitant, because if the patient is seeing the cost, the patient will never continue the therapy for a long time. So we try to make a package which is suitable for our patients, and we charge very a nominal fees of somewhere around 600-700 rupees per session, so that for our patients it's convenient in paying, and while getting the therapy done, the patient doesn't think about his or her pocket. And then again, if the patient is elderly, if the patient is coming from a below poverty line area, so there we have again a charity program. Like every month we choose 1 or 2 patients who are in our charity forum. So there we reduce the entire cost to 50%, like we hardly charge 300-350 rupees in that charity case. And when we are talking about our geriatric cases, so there also, depending on your therapies, so supposingly the therapy is going to go very long, say for 5 months, 6 months. So initial package which we charge is around the same cost, say 600-700. But after a while, when we are seeing that the case is running long, we reduce the package costs accordingly. So because we don't want that our patient is on the road of recovery and the cost comes in between. We don't want that. And our basic aim is basically to create a name for us here and not to just grab money. And that's our goal, and that's how we are trying to work it up.
So ma'am, one my last question for our audience basically. Can you please let us know something about your journey, where you started your journey, and how you came to this level where you have your own clinic now in the very good location, and your patients trusting you, and you have your own clinic, you're running your own team as well, who providing home services. So how difficult it has been to do all these kind of things, and to reach this level where you maintaining a high level of reputation, and how all these things has been happen. So please let us know something about your journey about it.
So when I talk about my journey, I think for anyone who has reached a level, it was not just a piece of cake. It was quite difficult. So I remember the time where even for a single visit, I used to go to people's houses and treat them. But I was always very particular on what difference I'm making by making them mobile and bringing them back into their stride of walking. So I started with that, where I was also a normal girl who was just planning to do something different, something big. That was my aim from the very beginning. And I took my education from Santosh Medical College. I did my bachelor's, I did my master's. Then I started seeing patients the minute I completed my education. There were house calls. There were people whose clinics I worked, and from there I slowly and steadily kept on building my pace. I worked in BL Kapoor Hospital. I worked at Dr. Magazine's Polytherapy Center. And from there also, again, one thing which I think was that helped me in my journey was the support which was there through my parents and now through my in-laws. That really helped. My husband, he has again been a great pillar of strength to help me reach this place. And God, who has always been there guiding me, and my patients. That is one thing. There is some connect when a patient comes to me and says, "Ma'am, that I'm in pain." So I take it quite personally. And you can say that I make it my life's mission to treat it. And I treat it secondly for money, and firstly for my own heart and for my good night's sleep. So that is something which I have been following. And we are now a little family of patients who come here. They all know me in person, and now I have a little kid also. So he's again, we all here, we are trying to do something different for the society. And hopefully, if you are seeing this and if this reaches you, try to connect with us, and we'll always be there to help you and to make your life pain free. Thank you.
So thanks, ma'am. You given us this your wonderful time. I know like you have to go to the like Ghaziabad as well, but then also we took more time because it was good. It is good actually for our audience, so they can come to you. They get some confidence, some knowledge. So that's why it is important to like share the complete knowledge, information actually. So friends, आपसे भी request है जितना हो सके हमारे channel को subscribe कीजिए. Keep subscribing our channel. So time by time you keep getting good interviews, good offers in your like local area doctors. So please keep support, and thanks ma'am for your wonderful time.
So I would conclude by saying that local Marks Doctors is doing a fantastic job, and they are taking in a lot of pain, running to people's clinics and their doorstep and trying to grab something which is fruitful for the society. So I suppose that if they continue this kind of work, they are gonna have a great future. And I wish them all the best. I wish them all the good wishes from me and my team, and so that they just continue this work, and more people would come to know through their channel and through their through their the way they are promoting their things. And the doctors, I suppose I wish them luck that more and more people could come and join this drive of theirs, where their mass awareness programs which they are running, we all can be a part of it and support to the maximum. Okay, thank you.